watching BloombergQuint. As of last evening, that's Tuesday evening, the Prime Minister of India announced a nationwide lockdown. This comes on the heels of several states already having announced lockdowns across the country. How effective will this plan be in protecting Indians against the coronavirus? I'm joined today by Dr. Jayaprakash Muliyil. He's a leading epidemiologist, PhD from the Christian Medical College in Vellore and Johns Hopkins University at Baltimore. And he has also served on several scientific advisory committees at the ICMR. Dr. Muliyil, thank you very much for speaking with BloombergQuint. Let me start by asking you about how effective you think a lockdown of this nature is likely to be.
Oh, you're starting with the toughest question. This is the only thing we could try. We have no alternative. Given the nature of the disease and the background of the country and the economic status, health resources, we have no choice but to try this. Because if you change the mean physical distance between two individuals on an average day's contact significantly, there should be a reduction in the transmission of the virus. And it will make some difference at least. How much is a question that is difficult to answer. It depends on the penetration we obtain in terms of informing people at all the villages and little towns and panchayats as to how important it is to block the transmission. And if that works and there is a reduction in transmission rate, we will probably be able to avoid the influx of cases that we are expecting in the absence of a lockdown.
Is 21 days enough, sir?
See, at the end of 21 days, the advantage is we will know whether it has worked at all or not. 2 weeks is too short. 21 is the minimum possible time. It may have to be extended, but 21 is probably the right choice because we will have some indication whether it has worked to some extent.
Is 21 backed by science in some way? I mean, is there some science that explains that these are the number of days?
It is actually based on, the cases that will emerge during the next 1 week would have been people who have been infected earlier. Correct? And after the lockdown, if the transmission comes down, then the impact will start showing after 1 week. So by 3 weeks, we will be able to show if the rising trend of an inflationary or what I call an exponential rise has been to some extent altered.
Do you think at this point in time we have, as last reported, 562 COVID-19 patients in India? Does that represent an exponential rise in India itself? Are we at that stage already?
I think we have chosen the time pretty correctly because we have established there is community transmission. We haven't gone into you're just about to enter into that phase. And we had waited some more time, it would have been a disaster.
And this 562 number, sir, do you believe it accurately represents the number of infected in India? Because there has been concern.
Not. It's a few thousand.
So you're saying at this point in time, we might already actually have a few thousand, but we don't know because we haven't tested enough?
That's why this will work. This is all poised to shoot up, and that's when we have to interfere. You may ask, couldn't you have interfered 1 week ago? I don't know the answer to that. But if you delay it any further, it will have been not so nice.
Let me ask you a question that all citizens are asking, both from the point of view of healthcare, their own personal security, as well as their economic options. Is this going to be the only lockdown that we will likely see? What happens after the lockdown?
The problem is that we are only going to alter the evolution of the epidemic.
Okay.
And we are actually buying time. Instead of, say, more than 100 million Indians getting simultaneously infected in the next 3 months, can we alter it to some extent? And this, if it works out, it will change the way we are coping with the whole thing. The thing is, if you really ask me, what would be the impact of this in terms of saving lives? We are actually aiming at the proportion of severely ill who would have lived had they received adequate care. You understand that one proportion of severely ill who seeks help in a tertiary care or a secondary level hospital, and they need ventilator support and things like that, and you're not able to provide, and you lose them. And that's when, we would have been found wanting. So if you stagger them, as you know already, there is a good chance that we can reduce the number of losses of avoidable deaths.
So what is the number of infected patients reported in the third week of this lockdown that will either give you some degree of assurance that we've managed to curb the exponential rise of this disease, or might, to the contrary, tell you that we haven't been able to do so?
Unfortunate part is testing in general has been a weak arm in our whole armamentarium. I think the first problem was availability of a good test. And the second is the problem of implementing it. And now that the tests have become available, we are in a better position to test. The second issue you are asking is, how will you know it has made an impact or not? It's a tricky question, I understand. But the first week's cases will be an indicator compared to the previous week. First post-week shutdown would give you a valuable data on the direction of the inflationary trend.
Okay. If I may ask you a slightly stupid question, sir, or a simple one, if I can call it that. After 3 weeks, if this lockdown is lifted, we'll still have infected people in the system. Will we need another lockdown to then curb the spread of the infection yet again?
The thing is, if you lock down and change the behavior of the people, and in general, you keep this distance of 2 meters, in general, you can make an impact. So there is two things involved. During this 3-week period, people learn to keep a distance from one another. And education to maintain that, close contact for some more time is dangerous. But as an epidemiologist, I know ultimately people have to become immune and herd immunity set in. But the point is this: if the transmission dynamics are slightly altered, we will be able to build up the herd immunity and not at the cost of lives. You understand? The recent statement from the Israeli defense minister: hide your grandpas and grandmothers. Now, keeping the elderly away as the epidemic smolders, not dies off, smolders, will be one way of building up immunity without losing too many lives. And I hope in the process, a vaccine will become available.
But none of this is going to happen in 3 weeks, sir. So, what is the scientific definition of...
Just taking the sting off the punch. It is just going to alter the shape of the curve. It will just flatten it somewhat. And I agree it is not going to change anything. People still get infected. But you can reduce the R naught by making sure the number of contacts per person that infected person gets is reduced because of behavioral change. And we have to invest on it. We have to demonstrate that it works. We should give hope to the people. By keeping it that way, we can keep the disease down. Now, that will not be sufficient to eradicate it, I agree. But at least the rate of transmission will come down somewhat.
Sure, sir. Flatten the curve has now become part of all of our vocabularies. What is the scientific definition of herd immunity? And at what number of infected in India would you say we've achieved?
If you don't do anything, the herd immunity of sufficient strength will occur within about 100 days.
Okay.
Okay? That is, you let things happen as in without any intervention, ignoring the whole thing. That will be a quick way to access. But my estimated, in that 100 days, there will be about 2.5 million deaths in the age group 60 plus.
Okay. And given this lockdown, by when do you think we'll achieve herd immunity?
Well, that will be delayed. And the delay, and also what is the level we need is an issue. Now,
right.
I spoke earlier in another situation that it will be probably 55%. But there are other estimates which is claiming it can be less. And there are even other estimates which say it will be higher. But I can't argue about it because I have no way of. But let me say the same thing I repeated. 55% is my expectation, given that I'm making a very calculated guess of a R naught of 2.8. Many institutions have come out with models. They have used 2.4. The most pessimistic of them is R naught of 5. So based on this, let's say 55%, and then we get a respite by the disease, nature of the disease itself, slowing down. Now comes this area. How did you manage to, direct? The infection is mainly in the active group. The isolated adult population, mature population, did not all that get infected. So the demographic structure of our country is such that it's a very tiny top section of the pyramid. And the bulk is younger. The younger people, when they get infected, they become immune, or according to our hope, forever. That will maintain the herd immunity. The adults, the much senior citizens are the problem.
Yeah. Dr. Muliyil, when you say 55%, tell me if I've understood this correctly. You're saying 5 out of 10 people in India will have to be infected by this virus for us to have reached herd immunity level. Is that correct?
No. 55% is a little more than half.
I'm just averaging it out, but that's what you're saying, right? And that effectively more than half the population will have to be infected by this virus for us to have reached herd immunity level.
And don't forget, the best estimate of subclinical infection is 50%. Best estimate of subclinical infection, that is no clinical symptom, infection and immunity, is 50%, the best estimate.
Is there any science, Dr. Muliyil, that suggests that the onset of warmer weather might actually help slow the spread of this disease?
I would like to believe in it, but I don't know. I don't think, but it is difficult to explain. I can understand to some extent, this may not survive too long outside in warm weather. But please don't forget, our body temperature is 37 degrees centigrade. And the virus happily infects us, lives there, and multiplies.
Well, you've explained it very simply. If we are able to slow the spread of this disease till we reach herd immunity, are we in for several months of social distancing, as it's being called? 6, 7, 8,
I don't want to call it
10
social distancing. I think you should still smile at people. Okay? The social distance, I'm talking about only physical distancing. All that matters to the virus is there should be somebody close by for the infected person to transmit the virus to the other person. Okay? You can still be waving at each other, be pleasant, but closer contact. The closer the contact, more risk of transmission. By Indian culture, the physical contact in general is limited. So we already keep a little distance in our general workspace and, with our neighbors and things like that. And so I think this may, but the thing is, my worry is, in our culture, majority of the people have no notion of virus, bacteria, herd immunity, nothing. What story do you tell them to make them understand? How do you get them to play the game with us and trust that this game they are playing will save the nation? See, this is that everywhere they will be playing with each other. They'll be interacting with each other. This virus. See, measles is a country where measles is a mother goddess and, chicken pox is another goddess. It's difficult to communicate the notion of virus and multiplication and transmission and things like that. So that is where, we need grassroots level transformation. And I think we need to grope in voluntary organization. People are already in the field in various ways and a multi-sectoral approach to make the story for them understandable.
So even if we were to able to flatten the curve, how many months of physical distancing will we need, to sort of arrive at some sort of safe position in this country? The reason I ask you is, whilst we might still be able to influence through cultural change, social interactions, what happens to the economy? Factories being able to come back online, people being able to commute to work in crowded trains. Those are concerns that, I was wondering if you could help address or explain in the months to come.
I don't have any argument with you. In fact, in earlier communication, I have said a strict clampdown would lead to social unrest. It will be detrimental to India. But the government move has been gentle enough so people can do it, because an excess of it is going to have the people will react badly. I told you all we have to do is, okay, wash your hands is fine. More important, keep a physical distance. So there is no harm in walking on the road, no harm in going into a grocery store, no harm in going to the office, as long as you keep a distance from one another. And this is the only inexpensive method. You don't have to invest anything in it, but trust people, make people believe that this will work. And it does work. There's no doubt about it. So the intervention required doesn't cost any money. And the life can go on without people, getting too close to each other. I'm not talking about family members. Okay, I'm talking about, and also the greatest relief is that the younger people are pretty safe from the disease. So you put that into equation, I think we should be programmatically, I think this idea of telling people that don't get too close to people, followed by gradual build-up, especially in the younger groups, younger decades, without hurting people, may save lives. And ultimately, one more thing, we have no other option except to go for this huge increase, exponential increase, where millions get infected and millions die.
So if I understand this correctly, sir, if the data in the third week of this lockdown suggests that we have succeeded in some measure to flatten the curve, so to speak, then you're saying that
some more with community support.
We might have to prolong some more.
How we won the battle is by keeping a distance and encourage them to do it for some more time, where things actually gradually return to normal.
But
no
just to be
policemen,
clear,
no lathis.
To be clear,
but we may not have big crowds, big weddings, big parties for probably another three more months.
And what about factories and workplaces?
They will go on. There will be some screening mechanisms in factories where large numbers are working, early diagnosis and isolation of people. But then when you do it piecemeal, there will be enough ability to arrange for these things. Now we don't even have places to isolate people or in a humane way.
Well, that brings me to my second theme that I wanted to talk to you about is the current capacity in India's healthcare system to be able to deal with this kind of herd immunity that you're talking about, or this widespreadedness of the disease eventually, as you point out. Now, we may be able to flatten the curve and take the load off the healthcare system in the initial months. But are we equipped to deal with it over the course of the next 6 or 9 months? What needs to be done on a priority basis?
You have asked me a very painful question. The healthcare expenditure has been pretty low throughout. And this is a kind of clarion call and say, hey, buck up, do something differently. And I think that this message has to go in. That is, these care centers, what we call, taluk hospitals, first referral units and things like that, are our mainstay for the country. Now, this is we did under the room of under the NRHM did something to improve the facilities for pregnant women and babies. I think we took the next step of improving facilities, but care of a person requiring ventilation is going to be very difficult. We need to transport people. There should be some sort of a thought about having some district level care centers which are capable of absorbing some of this problem. It will be too risky to say these things without giving it adequate thought. But we are woefully lacking to meet the demand in the context of a big influx of cases that we are aware of, and we feel sorry about it.
The government just announced a 15,000 crore rupee allocation to healthcare, and many state governments are suggesting they might have COVID-19 dedicated healthcare facilities. Are those good measures to begin with?
That is good. I hope it will be COVID today, it will be something else tomorrow. I think we have to increase our facility. The point is, no country in the world can face an influx that what COVID has created. You know that. So we don't have to feel sorry about that. But it really brings out that we have hardly anything available in many parts of the country. It's quite pathetic. At least we make a new beginning with this. The only issue I want to leave with you is that everybody should, at the end of it, understand the power to reduce the intensity of this epidemic lies in your hand, my hands, and each Indian's hand. And if we, each individual, each family, fight against the disease, it will make a difference. No government, no international agency, nobody can help us. We have to do the work ourselves. And for this, the only requirement we are asking is to be meticulous in terms of protecting yourself and protecting others. If you can pass this message instead of worrying about where the ICUs will be, there won't be any. It itself will make a big difference in the health scenario here.
Well, Dr. Muliyil, thank you so much for your time, and that message is well taken. We're in early days of the lockdown, and we hope to be able to revisit some of these questions with you in week 3. Hopefully the data then will be more encouraging. Thank you so much for speaking to
Bloomberg. I am in the high-risk group.
Well, so we have our fingers crossed for you, for all our parents, family, and friend members, and we hope that all of it will come to a happier ending than right now anticipated.
According to a recent report, women today contribute